In this video, we will cover Chapter 5 Medical Terminology, Cardiovascular System. This video consists of more than 100 flashcards of medical terms, questions, and answers. Now, let's start. Aort. Oh. What does it mean? It means aorta. For example, the aorta of the heart. Artery/O. Artery/O means artery. Ather/O. Ather/O means plaque, fatty substance. Angie/O. Angie/O means relating to blood or lymph vessels. Brady. Brady means slow. For example, bradycardia means a slower than normal heart rate. Emia. Emia means blood or blood condition. For example, leukemia, a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Cardi/O. Cardi/O means heart. Crasia. Crasia means mixture or blending. Erythra/O. Erythra/O means red. For example, erythrocyte, which is red blood cell. Ven/O. Ven/O means vein. Leuke/O. Leuke/O means white. For example, leukocyte means white blood cell. Phleb/O. Phleb/O means vein. For example, when we go get blood drawn for lab, that's called phlebotomy. Tachy. Tachy means fast, rapid. For example, tachycardia. Throm/O. Throm/O means clot. Hem/O. Hem/O means blood, relating to blood. The term meaning white blood cells is leukocytes. Lifeco means white. Cytes means cells. Commonly known as the natural pacemaker, the medical name of the structure is what? The term is sinoatrial node. The myocardium receives its blood supply from where? From coronary arteries. What is the term that formed in red bone marrow and then migrate to tissues throughout the body? These blood cells destroy parasitic organisms and play a major role in allergic reactions. Those are eosinophils. The bicuspid valve is also known as what valve? That's the mitral valve. It's a small flap in the heart that's located between the left atrium and the left ventricle, the upper and lower left chambers of the heart, respectively. What pumps blood into the pulmonary artery, which carries it to the lungs? The right ventricle pumps blood into the pulmonary artery. What are the smallest formed elements in the blood, and do they play an important role in blood clotting? Those are called thrombocytes, which are platelets. A foreign object, such as a bit of tissue or air, circulating in the blood is known as what? It means embolus. What carries blood to all parts of the body except the lungs? That is the left ventricle. What are the most common type of white blood cell? Neutrophils are the most common type of white blood cell. In the human body, when we mention a hollow muscular organ, We think of what? If you think of the heart, you are correct. What is the medical term for cardiac muscle? That is, myocardium. What about epicardium? What does it mean? Epicardium is an external layer of the heart. What does endocardium mean? It's the inner lining of the heart. Pericardium is? Pericardium is sac enclosing the heart. High-density blank is also known as good cholesterol. High-density lipoprotein cholesterol. An abnormally slow resting heart rate is described as what? An abnormally slow resting heart rate is described as bradycardia. In what fibrillation, instead of pumping strongly, the heart muscle quivers ineffectively? That is called ventricular fibrillation, or VFib. The highest pressure against the blood vessels is called what pressure, and it occurs when the ventricles contract? That is called systolic blood pressure. If you have not done so, please click the subscribe and like buttons. The diagnostic procedure that images the structures of the blood vessels and the flow of blood through these vessels is known as what? That is called duplex ultrasound. A bulge, or swelling in a blood vessel wall, that's caused by a weak spot, is called what? That is called aneurysm. A deficiency of blood passing through an organ or body part is known as what? Hypoperfusion. What is the term for an abnormal heart rhythm in which the heartbeat is faster or slower than normal? The term is arrhythmia. A disease that is a condition with symptoms that include intermittent attacks of pallor, cyanosis, and redness of the fingers and toes is called? It's called Raynaud's disease. An implantable cardioverter blank is a double-action pacemaker. An implantable cardioverter defibrillator is a double-action pacemaker. CAD stand for what? CAD stands for coronary artery disease. Other terms for electrocardiogram. Other terms for electrocardiogram are EKG or ECG. AFib is shortened for what term? AFib is for atrial fibrillation. MI stands for what? MI stands for myocardial infarction, which means heart attack. VFib stands for what? VFib stands for ventricular fibrillation. The systematic condition often associated with severe infections, caused by the presence of bacteria in the bloodstream, is known as what? It's known as sepsis. What class of medication reduces the workload of the heart by slowing the rate of the heartbeat? Beta blocker reduces the workload of the heart by slowing the rate of the heartbeat. The blood disorder, characterized by anemia, in which the red blood cells are larger than normal, is known as what anemia? It's called megaloblastic anemia. What is a class of drugs administered to lower high blood pressure? It's called antihypertensive. A bacterial infection of the lining or valves of the heart is known as bacterial what? It's called bacterial endocarditis. Plasma, with the clotting proteins and the blood cells removed, is known as? That is called serum. Having an abnormally small number of platelets in the circulating blood is known as thrombocytopenia. The surgical removal of the lining of a portion of a clogged carotid artery leading to the brain is known as? That procedure is called Carotid endarterectomy. The abnormal protrusion of a heart valve that results in the inability of the valve to close completely is known as what? It's known as valvular prolapse. The medication that is prescribed to prevent or relieve the pain of angina by dilating the blood vessels to the heart is nitroglycerin. Aneurysmorrhaphy. Aneurysmorrhaphy is a combination of aneurysm/O and raph, which means the surgical suturing of a ruptured aneurysm. A means what? A means absent, not without. For example, aplastic anemia is characterized by an absence of all formed blood elements. Elector/O is? Elector/O denotes electricity or electric. For example, electrocardiography. Electro combines with cardi/ography. It means the process of recording the electrical activity of the myocardium. Poly means? Poly means many. For example, polyarteritis, combination of arteritis. The inflammation vasculitis, involving several medium and small arteries at the same time. What does valvuloplasty mean? Valvuloplasty is a combination of valvule/O, valve, and plasty, to open. It's the surgical repair or replacement of a heart valve. A thrombus is a clot or piece of tissue circulating in the blood. True or false? False. A thrombus is a blood clot that forms in a blood vessel and remains there, potentially causing blockage. When a clot breaks loose and travels through the bloodstream, it is called an embolus. Hemochromatosis is also known as iron overload disease. True or false? True. Plasmapheresis is the removal of whole blood from the body, separation of its cellular elements, and reinfusion of these cellular elements, suspended in saline, or a plasma substitute. True or false? True. A vasoconstrictor is a drug that enlarges the blood vessels. True or false? False. Vasoconstrictor is a drug that narrows, constricts, blood vessels, which increases blood pressure. The term for drugs that enlarge, dilate, blood vessels is vasodilator. Angiogram. Angiogram. It means record X-ray of a blood vessel. Aortic stenosis. Aortic stenosis. Aort, Eichsten, O-sis. It means narrowing of the aorta. Arteriosclerosis. Arteriosclerosis. Arteri, O, sclere, O-cis. It means hardening of the arteries. Arterial anastomosis. Arteri/alana/stom/o/cis. Arterial anastomosis means surgical connection between arteries. From the Greek anastomoen, providing a mouth. Endarterectomy. Endarterectomy means removal of the inner lining of the artery when it is filled with plaque. Arteriography. Arteriography. It means process of recording, X-ray, arteries after injecting contrast material. Atheroma. Atheroma means collection of fatty material in an artery. The suffix oma means mass or collection. Atheromas are collections of plaque that protrude into the lumen, opening, of an artery, weakening the muscle lining. Lumen. Lumen means opening. Brachy/O. Brachio means arm. Brachial artery. Brachial artery is artery that branches from the aorta to bring blood to the arm. Cardiomegaly. Cardiomegaly is the enlargement of the heart. Cardiogenic shock. Cardiogenic shock is the result of the failure of the heart in its pumping action. Shock is circulatory failure associated with inadequate delivery of oxygen and nutrients to body tissues. Statins. Statins are drugs that work by blocking a key enzyme in the production of cholesterol by the liver. Cyanosis. Cyanosis is an abnormal condition of bluish discoloration due to poor oxygenation of blood. This bluish discoloration of the skin indicates diminished oxygen content of the blood. This condition is a benign tumor made up of newly formed blood vessels. This condition is called hemangioma. After his surgery, the patient developed a deep vein blank in his leg. Deep vein thrombosis. During her pregnancy, Polly Olson suffered from abnormally swollen veins in her legs. The medical term for this condition is what veins? The medical term for this condition is called varicose veins. A patient suffers from episodes of severe chest pain due to inadequate blood flow to the myocardium. This is a condition known as angina. When Mr. Klein stands up too quickly, his blood pressure drops. His physician describes this as postural or orthostatic hypotension. This bone marrow disorder is characterized by the insufficient production of one or more types of blood cells. It's called myelodysplastic syndrome. Dr. Lawson read her patient's blank. This diagnostic record is also known as an ECG or EKG. Electrocardiogram. Jason Turner suffered from cardiac arrest. The paramedics arrived promptly and saved his life by using what? Cardiopulmonary resuscitation, or CPR. Darlene Nolan was diagnosed as having a deep vein thrombosis. Her doctor immediately prescribed what to cause the thrombus to dissolve? Thrombolytic, which dissolves the clots. The atherosclerosis of the coronary arteries that reduces the blood supply to the heart muscle. That is called coronary artery disease. A what? Which is a characteristic of atherosclerosis, is a deposit of plaque on or within the arterial wall. It's the atheroma. What term means to stop or control bleeding? Hemostasis. Inflammation of a vein is known as phlebitis. Myxoma. A benign tumor of the heart that is embedded in soft mucoid stromal tissue. A benign tumor derived from connective tissue, with cells embedded in soft mucoid stromal tissue. These rare tumors occur most frequently in the left atrium. Auscultation. Listening to sounds within the body, typically using a stethoscope. Arteritis. Arteritis is the inflammation of an artery or arteries. Angiectomy. Angiectomy is the surgical removal of a portion of a blood vessel. Phlebostenosis. Phlebostenosis is the abnormal narrowing of the lumen of a vein. Pericardiectomy. Pericardiectomy is the surgical removal of a portion of the tissue surrounding the heart. Hypoxia. Hypoxia is a condition of decreased oxygen in inspired air, as occurs in high altitudes. Inadequate oxygen in tissues. Anoxia is an extreme form of hypoxia. Instrument to measure blood pressure. A manometer measure pressure is called sphygmomanometer. Thank you for watching. Don't forget to subscribe, like, and share.